Oh, we're live now. Comes Liz. Maureen, are you able to change Casey's name?
Oh, yep, that's what happened. Sorry.
Maureen, it is streaming on YouTube. It's live. You're muted though.
Hey, Doc.
Hey there. Here's Maureen.
Sorry, I wanted to mute myself while I was on the phone, trying to figure out what was wrong.
All good?
Yes.
Okay. Great. Well, welcome everybody. This is the Wyckoff Board of Health work session. It's February 11th, 2021. I want to welcome everybody. What we're going to do is let's start with the Pledge of Allegiance and then we'll start taking things from there, okay? So if you wouldn't mind standing.
Share my screen.
And I will lead you in the Pledge of Allegiance. I pledge allegiance to
To the flag
To the flag
of the United States of
United
America
America.
and
and
to the republic
for which
For which
for
it
which it
stands,
stands, one nation,
under God,
indivisible,
indivisible, with liberty and
and
justice for all.
Thank you. Cindy, our secretary, would you mind doing a roll call, please?
Sure. Dr. Yee, Steve Clark,
Here.
Devalina Sen,
Here.
Donna Garbacio,
Here.
Michael Sparazic, Lynn Spreen Raffo,
Here.
Peter Melchione,
You may be coming on a little
Linda-
late.
Linda Brock,
Here.
Casey Culinary,
Present.
Laura Folka from Bergen County. Here. And myself.
Great. Would you mind reading the Open Public Meetings Act, please?
Please take notice that in accordance with the Open Public Meetings Act, NJSA 10:4-6, and in consideration of Executive Order Number 103, issued by Governor Murphy on March 9th, 2020, declaring a state of emergency in the state of New Jersey, the Board of Health of the Township of Wyckoff does hereby notify the public that to protect the health, safety, and welfare of our citizens, the meeting of the Board of Health of the Township of Wyckoff, scheduled for Thursday, February 11, 2021, will be conducted virtually through the Zoom video conferencing application, and it will be live streamed on the Township of Wyckoff YouTube channel. The work session is scheduled for 7:30 and the public business meeting will begin at 8 p.m. These measures are implemented to allow members of the public to observe the meeting via live streaming and to provide the ability to comment during the periods for public comment during the meeting through Zoom telephone call in technology. Joining the meeting by telephone will be utilized as security against the sharing of inappropriate video context. General instructions regarding access to the meeting is posted on the Wyckoff website's homepage at www.wyckoff-nj.com as a news item. This regular work session meeting of the Wyckoff Board of Health is now in session. In accordance with the Open Public Meetings Act, notice of this meeting appears on our annual schedule of meetings. A copy of said annual schedule has been posted on the bulletin board in Memorial Town Hall. A copy has been filed with the municipal clerk, the Record, the Ridgewood News, and the North Jersey Herald and News, all newspapers having general circulation throughout the township of Whitehall. At least 48 hours prior to this meeting, the agenda thereof was similarly posted, filed, and mailed to said newspapers. Formal action may be taken at this meeting.
Thank you, Cindy. Appreciate it. This is the part of the meeting where we open it up for public comment. If anybody has it, we can hold it off for a little while as well. But as we do each and every meeting that's a public entity of the governmental procedures of the town and the state, the public is allowed to comment. We'd like to leave the comments to a maximum of 5 minutes per person so that other people can call in or speak. So I'm looking at the schedule. I don't see anyone from the public on the meeting at the present time. So,
I have a quick comment, Steve, Doc. I'm getting tremendous reverb, like I'm hearing echoing.
Okay.
I think if anyone is not speaking,
you put it on mute.
Yeah.
Yeah. Try.
Okay, that sounds much better. Great, thanks.
Okay. Well, good. Okay. All right. Now, has everybody had an opportunity to read the minutes from the last meeting, which was January 14th? That was a virtual meeting as well, and it's also on YouTube. You can go look at it again if you'd like to see or review some of the things there. So does anybody have any comments, additions, any corrections on that they want to talk about? Everybody had a chance to review it?
Yeah, no, really.
Everything good? Then what we'll do
I
is
reviewed
Really
it,
looks
it's all
good.
correct.
so just by show, I'll entertain a motion to accept those minutes.
So motioned.
All right, motion by Sprazek, second by Develina. I saw Develina's
Yeah.
hand, thanks. Okay, any discussion on the motion at all, anything? Okay, just by a raise of hand, all in favor, say aye. Everybody got their hands up?
Aye.
Okay, any opposed or any abstentions? Okay, all right, thank you so much on that. We're going to go right into the reports of the president. That's me, and the minutes, what we had before, and any kind of members that have any issues. There's a lot of things. I mean, you know, everything is all COVID all the time. There's a lot of good news, although people wouldn't know it, that there's a lot of good news going on with COVID. The numbers are dramatically down across the country. I mean, we may not see it in this area, but across the country, they're plummeting. The CDC this morning said that there's an average of 108,000 Americans that have a diagnosis of COVID each day over the past week. It's a 24% decline from last week alone. Hospitalizations are down 8% and deaths are down 3%. So people are still doing the right things with masking and cleanliness, as they should be all the time, but even more so now with COVID. On January 8th, there were 318,000 new cases. February 8th, 86,000. It's down 250,000 new cases. That's dramatic. And that's coming off the CDC site. There's been 68 million doses of vaccination that's been delivered across the country. 46 million have been administered already. So there's a lot of, you know, although this area you see everybody scrambling to try to find an appointment and to get a shot, it's out there. 34 million Americans have gotten their first dose already. 11 million have already gotten their second dose. So you can see that the numbers are really starting to creep up, and you're starting to see where they're working towards herd immunity, if that's ever going to happen. But those are positive things. And sometimes you hear the news or you're on our Facebook in town and you hear panic in people's voices about getting the vaccine. It's coming in. The numbers are dropping. People are doing the right things, and that's really good. And that's part of our job, is to educate people and keep them educated as to doing the right things. So that's good news. That is my report. What I want to do is I want to go over to Laura. We're really happy to have you here, Laura. We miss Michelle, but we're happy to have you and your expertise from the county. So do you want to give a little overview of what you're working on? And then we have some easy questions for you, some things that'll be helpful for the public that are listening in or will be listening in on YouTube at some point.
You got it. Thank you. Can you hear me, Stephen?
perfect.
Thank you. It's such a pleasure to be here. My apologies for the video. I did try twice. I'm not sure what's going on, but I can see and hear all of you, and it is such a pleasure. Michelle is great, and I actually was kind of glad that she didn't have the opportunity to come tonight to give me an excuse to meet you all and just let you know what our role is here. So Michelle is a supervisor in your district, handles Wyckoff, and reports to me. We do like 35 some odd towns in Bergen County. I've been handling a lot of the COVID related items. So you'll see my name on your report here and there. And it's just to kind of streamline everything because the guidance changes pretty much on a daily basis. So to try to bring 18 inspectors up to speed on that and keep everybody on the same page was getting a little out of control with the updated guidance changing left and right. So we tried to keep everybody in their field of expertise and their daily operations. So Kristen and Michelle are really awesome with septics, the foods, and following up that way. And so I just started taking on all of the COVID related complaints. Started a relationship with your Wyckoff Y. They are amazing. My mom lives in Wyckoff, so I know the area. I know a lot of the people. I grew up there for a long time on Franklin Ave, and am happy to be a part of the community in a way with that, to share some of the guidelines. They get very confusing, so we try to provide that compliance assistance wherever possible with these executive orders, which now I think are in the 200s. So we're getting up there. It is it's a challenge trying to remember which order goes with what, but doing my best, and really have not had a problem. I wish I could clone you guys and have Wyckoff across the board for all our towns, between the residents and the community, any business that I have spoken to. And again, I'm calling out the Y just because really I've had the most contact with them, but are really so proactive and looking to keep your community safe. And that is just such an attestation to all of you and the town. And happy to be a tiny part of it here. So thank you.
Great, really, really great, and great to have you and your expertise. There is a lot of expertise on this board, as you'll see, but really appreciate having you here and some of your insights. A couple things I'd like you to talk about, maybe Laura, just so we can bring everybody maybe a little bit up to speed on certain issues that might come up when you go out to different organizations. We had an instance this week where people were not doing the best on social distancing and masking. And can you talk a little bit about that, just generally, not specific on the organization in town, but how fast this came up within the past day, and you've already handled it and we've moved on from that. Can you give a little overview?
Sure. Yeah. If we get an inquiry, a complaint, or a concern from a resident about a facility or a business that may not be as attentive to the COVID-19 guidelines, the first thing we do is reach out to the complainant just to get a picture of what they saw and when, what was the situation, what time of day, what were the activities that were happening at the time, just to try to get as much information as possible. And Cindy, I see you there. It's nice to see your face. I know we have a little, a small email change here and there. So when we pick that ball up and contact the owner, I try to get a good dialogue and let everybody becomes defensive immediately. So I try to just kind of break that down as fast as I can. Just say, hey, listen, we're all on the same page. We all have the same goal, and that's to make your business thrive, be successful, but keep the residents and your patrons safe. So we'll review. Usually there is a set of guidelines for each entity. The state's done a good job with trying to keep sports guidelines, indoor dining, outdoor dining, the tanning, they're all separated out. So just to try to find that set of guidelines for that facility, review them in detail, and try to get a picture from them of where they think they may be lacking and how to make that a little bit stronger. And sometimes it is a little bit of a reality check because they're busy, they're looking to make business, they are just trying to make ends meet. But a little bit of public safety can get lost. So it brings them back to the center and to have that conversation. I mean, we loosely call it compliance assistance, but pretty much that's what it is, hey, how can I help you come into compliance with the state regulations and governor's executive orders during this pandemic. Let's do this together, and we've been successful so far.
Oh, Laura, I had a quick question. Just to circle back on the why. I've heard excellent things. One of my friends sends their daughter there, and anything that you notice that they're doing in compliance that is above and beyond that you were like, wow, that's something that maybe we, something I would reach out to other businesses to do, or, guidelines that are, I have heard that they've just done an excellent job over there.
They are stellar. They are so stellar. And I
Yeah.
don't know if it's the efficiency of the staff. They really are, they focus on that screener. They really do a good job with the screener to the point where it's not rote, where I can even tell you in my workplace, that screener becomes rote. You get jaded and you don't even see or hear the questions anymore. You just go about, no, I haven't traveled. No, I haven't this. No, I haven't that. If you get in that rut of you're not even hearing the questions, that is one thing that the Y is doing, is they're actually looking at those screeners where they
That's very important. Mm.
Yeah, and it is important. They're actually laying eyes on it and absorbing it. And they had somebody in the healthcare profession where they answered very honestly on a screener and said, yes, I'm around people that are positive, but I would like to use the gym. Down to that one person, they will make a phone call. Hey, Laura, this is what the scenario is. I was thinking about doing this, this, and this. What are your thoughts? And so they're I think just the word I'm looking for them is attentiveness. And they're just great. And I think I've heard from them on every little thing between pool, daycare, after school, gym. They hit it all. So they have that big facility there. And it's confusing because with their youth camps over the summer, they fall under probably 6 different sets of guidelines in that one facility alone. And they're like rock stars with dealing with it,
Very good, very good. And again, that issue came up within the past couple of days, and you were responsive right away, Laura, and you went over there, educated the people, smoothed it over, and everybody just moves on. Just as you said, you're here to educate, and that's what we're doing as well.
Absolutely.
I had a question for you. We know Hansel is at Bergen County, and I'm sure he's running in all different directions. Is there a second officer of the day, or is next in command if we need to get a hold of? I mean, I'm sure he's getting bombarded with phone calls and all day long texts and emails. Is there another person where we can pick up the phone? Listen, we don't need Hansel, but we need guidance on this. Would you be the person that we would, we could call right away, or is there someone else, or how does the chain of command work with that?
I can be. I'm probably a little bit more accessible than he is. I think if he could clone himself, the same as all of us probably feel, it would be great. So depending on, we have such a wide variety of services and so many directors that it probably may not be him that you need. But if I don't know the person to direct you to, I'm happy to get you there. So for sure, Cindy's got my email is the best way to get me. So if something comes up, if it's not me, but perhaps the director of our mental health law project would be the one, or it could be more of an environmental issue and the director of our CHA program. So if obviously it's a Hansel question, we're going to funnel you that way. But yeah, feel free to reach out to me anytime.
Good. Yeah, sometimes there's just easy questions that someone poses to me or to Cindy or any of the members of the group here, pass it on. And, we kind of need a fast response, but it's not a heavy duty response, just a quick response of what we should do or how we should handle it.
Absolutely. And one thing I'll be is honest. And if I don't know the answer, I'm not going to pretend to know it, but I'll let you know. I'll try to reach out to who has that answer and get back to you as soon as possible.
Great. I wanted to talk to you a little bit, and of course, I don't want to jump over anybody at the board, but when you enforce the executive orders, it's not Bergen County that's making these rules and making the rules for the schools or when kids should go out or anything. That's coming down from the state of New Jersey. Am I correct in that assumption?
Absolutely.
All right. So there's no leeway there. What you're doing is you're bringing down the orders from the state of New Jersey. You bring it from the county level, and you bring it to our local organizations or schools. There's been some concern that, Bergen County, maybe has a little different set of rules than everybody else. we're playing right by the rules all the way down the line. Is that correct?
Absolutely, 100% correct. All of the guidance is coming down from the state. Anything left up for interpretation obviously could potentially be interpreted differently across the board between different counties. But bottom line is we're all falling back on that same guidance, especially for schools. That matrix is lengthy and specific. It doesn't leave a lot of room for interpretation, which is good, but all of those decisions, our communicable disease team will work directly with the superintendent, school nurse, and make those decisions together. And there is a lot of case by case things, but for the most part, you are 100% correct. Those guidelines are not from the bottom up; they're from the top down, and we don't change them.
That's very,
Steve?
very good. Yes, Devalina, please.
Hi, just a quick question about right now in this phase of vaccinations. I understand that educators are part of it, right? But in our school district, is there like from Bergen County, there is a special effort for the educators to get vaccinated, or it's just they have to register just like anybody else? When they get called, they get called. Like, I got a few questions from the teachers depending on where they live, and they couldn't get on it. I mean, I myself can't get on it, even though I have an active license. So how do we handle that, these kind of questions?
All of the guidance that I've seen for vaccination protocols have trickled down from the state, and they're even trying at the county level. We're partnered with Newbridge to run our vaccination site. They're trying to, even through, without even directing people to our site, are still telling people go to that New Jersey COVID hub for the information to keep that continuity, because they don't want a broken down group getting down where it is not encompassed in what the state has already determined is your current group for vaccines. So even though there's 1,000 different ways to register between CVS or a mega site or the COVID hub or Newbridge or Valley, it's Jersey. It wouldn't be easy. It wouldn't be Jersey if it was easy, but they're still trying to keep everybody on that same page with go through that COVID hub so that the information stays the same.
Yeah.
So those outside groups, unless the governor is making the announcement that says that group is now defined in the current group to be vaccinated, the county is not going to go outside that group.
Makes sense. Thank you.
Sure.
Questions? Other questions about the schools? Donna? You're on mute, Donna.
So Laura, welcome. I haven't met you, and I want to say I am also a school nurse in Indian Hills in Oakland. And I must say that the county has given us tremendous guidance at times when we need it, and your recommendations, we do take them very seriously. So I want to say again, thank you for the team. And again, it is a group and team effort. I would also like to say that our screeners that we use on a daily basis for the students and for staff have really been working. Like, and I hear it from you about, at the Y, I think that was a great tool that was developed because we are, finding students that either are showing up on the wrong day or they have a little symptom, and then we follow it up, and then sure enough, it leads to something else. So it really, that the screening tool has been great. And I wanted to say thank you again to the county for your guidance. I was wondering, I know there is a lot of frustration that Devalina said about the vaccines and signing up. I hear only positive things about the Bergen County Newbridge organized. Is there any talk about maybe making a Bergen County mega site like the one in Rockaway or down in Atlantic City? Is there any talk? And if you have any pull or someone you can talk to about it, maybe to get a mega site here closer to Bergen County, since we really were high with the numbers. I don't know your thoughts on that. Has there any been talk on that?
Yeah, and I think they were counting the one at the Meadowlands for East Rutherford for that one, but even more for Bergen County, different from the other counties in New Jersey. You've got 70 some odd little nooks and crannies here where we might be the county health department, but not every town contracts with us for health services. We're all over the place. You've got 70 mayors, 70 OEMs, 70 so we were almost looking at, hey, let's take this show on the road. So between a mega site, we're hoping once they get the number of vaccines to be able to be out there, especially with J&J, something that is a little more free to travel, to try to set up pods in the towns and think of it more as like go regional versus mega, because you've got the East Rutherford for mega, but looking at pods where maybe you do, like, we separate our county into 4 districts, and maybe you put a pod in each one and do a regional thing for distribution. So it's definitely on the table. The resources are not there to regulate it yet because we don't know when and where the vaccine is coming. But once that frees up, it's all in the works. And our suggestions also have been to try to get it to the people that can't leave their home, or the senior population that doesn't have access to the internet and are used to flu clinics coming to them, people coming to them. So to try to figure out a way as well to take the vaccines homebound as well. So it's all on the table. We just don't know what it'll look like yet.
Casey.
Laura, real quick to follow up with that. I mean, what I've heard is, and maybe correct me if I'm wrong, I believe there are no more sites being allowed open by the governor at this time, right?
Right. For the
If
number
they're
of
not
vaccines that
designated
are out
now,
there.
right.
Yeah, to become a provider to actually run the site is pretty difficult. So that's why they would
Right.
wait until a provider that's already established could then take the show on the road, if that makes sense.
Right,
But yeah,
because
to have
we've
something
heard, I
pop
don't know if
up.
you've heard, there's been some, like, there was a lot of talk I heard from people in town saying, oh, can you get a site in Wyckoff? And I just don't people think understand the logistics of getting that site, of properly distributing that vaccine, because as of right now with Moderna, until the Pfizer comes, you have to keep these so cold in the cold storage and the proper handling that they have to be kept, and the guidelines that, you don't want to, it's not like you just open a site tomorrow. It takes a lot of thorough research and making sure that site's fully monitored, correct?
Absolutely.
Yeah.
And the steps were so complex that when
Mhm.
looking at them, even Bergen County is not established as a provider.
No.
We went with Newbridge and said, let's pool resources. We can get more vaccine out to the public. We've got the location, we've got the facility, we've got the staff. Let's partner. So for that is kind of the way I try to explain to the smaller towns to say, it's not that you don't have the volunteers or the means. I'm sure you could even do a drive-through if you needed. It's the other logistics that go into becoming a provider, and those calls that come in that say, yeah, but I saw Bergenfield, they're a smaller town. How did they were already established. They were already an established provider. So some of the things were already in place, but it doesn't mean that can't change.
And to follow up with that, hopefully, like you said, when Pfizer, J&J comes online, it's a lot easier for distribution. I'm sure they're going to probably, by the time when the numbers ramp up, right, Doc? You think they'll be giving them out to the local doctors, so they'll be able to administrate them, from your own doctor, hopefully.
That would
Probably
be
true.
amazing if that could happen.
Yeah. And there's also logistical, what's happened also too is that, and just as Laura says, it's not that easy to set up. And I've gotten a lot of calls. Well, how did Wayne get 300 shots over there? Well, 300 shots means 150 people. Can you imagine, how do you allocate 150 people in a town like Wayne that has 54,000 people? Who gets it and who doesn't? Who gets upset if they don't get it? We have 13,000 in Wyckoff.
Vaccinators. Yep.
Right. Same thing. We have 13,000 people in Wyckoff. Can you imagine if we got 150 shots with 13,000 people? People would be furious. The Ridgewood site has fallen down now. They have no vaccine. You saw Rowan College. They vaccinated the nursing students down there the first shot. They didn't have any for the second shot now. So they were scrambling. Where do you get the vaccine? So it's almost better not to give it out in small segments than that. than to have it create a disaster as it could be.
And I think to your point, Doc, that is very true. And I
Thank you,
think
Laura.
that, having a lot more control over it helps. And with the mega sites, they're able to, schedule better, and they, as the vaccine rolls in and rolls out, they just have more control over it versus a small town where if someone doesn't show up for their shot, now what do? Now you're scrambling with an extra shot, and it becomes a logistic issue I think in a smaller environment.
Well, in many places, once they have the vaccine shots, they're calling people on the wait list and stuff. But that's only happening at the hospitals and for employees or the other like office employees for the medical officers and stuff. But I really wish like we could set up in our like if we have immunizers or nurses on board, which we do. I mean, if the towns can do their own, I mean, we will all be vaccinated by now. The number of immunizers are there in this group itself. But I don't think they want to do it that way. Even our CVS in Wyckoff it's not on the list.
You're on mute, Steve.
Laura, I just to follow up, I didn't know about you had to be an established provider. So that is an involved process, a lot of lengthy process to be a provider to establish for vaccine distribution.
I believe so.
Okay.
Yeah.
I didn't know that.
Yeah. Or there are primary care
I
doctors
think,
that
Laura,
apply.
thank you.
Go ahead, Simon.
Sorry, Steve.
No,
I
you're-
think Laura has answered a lot of questions that our community has had, and that's really important because that's come up, numerous times in the past couple of weeks. And I think that distribution is just going to be on a broader level than the local municipalities at this time. So, Laura, thank you so much for that clarification. I think that will be helpful.
Absolutely.
You're
Thanks,
right, Lynn.
Laura.
Even today, CVS announces they have 19,000 shots. It sounds like a big deal. They have 27 locations. It opened up at 7:00 in the morning. Probably within an hour and a half, it was closed up 2 hours. Everybody's scrambling trying to get it. Well, imagine the whole state is trying. So it really, and then we're hearing that even Walgreens doesn't even have the vaccine.
No.
Then they're saying that they do. That there's an announcement that Walgreens is going to be given a shot, but they don't have the vaccine yet. So
For the entire state, right, it got 7,500. That's like
Right.
nothing.
I know. I think
Well,
people
I
have
mean,
to understand you need patience. You have to have some patience. It's been a year. You've done well. Keep doing the proper things. You're gonna get your vaccine. Hang in there.
I
Hey,
think
Casey.
also, Doc, to circle back to that email I think you had sent it about the CDC with the new guidelines coming out and without, once you have gotten your second shot of the two vaccine, either one. But I think the details that a lot of things that are missed that people don't understand is that you have to still wait the 2 weeks. The CDC says, so once you've gotten your second shot, if you come in contact with somebody, you still have to quarantine until you get to the 2 weeks. There's a lot of details that are hidden in the facts that people miss. And I think that, always trying to make sure everything, and that's what I know Laura always very on top of that too with the information they give us, is that you have to follow the guidelines. That's the key. You have to follow the guidelines.
That's great advice.
Right. And no bending of the rules, right, Casey?
No bending the rules.
No
6
bending the
feet.
rules. You're right. You're right. Go ahead, Laura. Just tell us just a little bit more of what's going on county-wise, and then we'll keep moving on the agenda.
Sure. Did you want me to touch on another subject or?
Well, I wanted to, first of all, how's our friend Noemi doing? Because that's been our contact. I talked to her last week, and as Lynn at the top has been giving vaccinations, it's been nonstop. Lynn, I think you did 300 on Friday last week. Is that correct? You're on mute.
Sorry, about 240, 250 per day.
Right. And
Yeah,
don't forget, everybody, that's
these were
gloves
on
on, gloves off.
That was a change, 240 gloves and hand sanitizer in between with full PPE. But again, it was such a positive atmosphere and a rewarding thing to do. I know that at one Englewood had given well over 1,400 vaccines in one day. So now they're splitting the day. The volume is just very high, but all with good outcomes, thankfully.
Good. Anybody have any questions for Laura?
I guess,
Anything more
Laura,
you-
the last question I had is before, and this is, something the CDC hasn't really, it's touched upon it and you read about it. Even after you get your vaccine 90% effective, they're still finding, there's nothing that says that you can still spread the virus being vaccinated. They're finding cultures in the nose. And I think that there's a public awareness of, even if you've been vaccinated, doesn't mean you can still spread the virus. Correct? If I'm wrong on that?
I don't want to speculate on that yet because I haven't read it. We're kind of anxiously awaiting the update to the chapter for that CDC research to reach down, trickle to New Jersey, and then our CDS at the state level will adopt that and forward out the guidance, because it touches everything. Just like you said, if you think about it. So if you are an exposure where normally now you'd have to quarantine for 14 days or 10 or 7 with the test, how is that going to affect somebody that's now had 1 dose of the vaccine? How does that affect somebody that's now had 2 doses 2 weeks later? So all that guidance needs to change. We are anxiously awaiting it. And I know they need the data to support their recommendations for that guidance. So if I could put a guess out, so I'm on these state calls at noon every day where these questions are just out there, like help us with, especially with schools. If we don't have to send an entire class home because perhaps the teacher can, is vaccinated, what all of these questions, I'm hoping within the next 2 to 3 months, they can update that investigational chapter and give us some updated quarantine and isolation. So we're anxiously awaiting that.
And so am I. I'm excited to hear too what's in store. So, especially for the schools. So.
Yeah, I think the schools have been the biggest challenge for someone like Donna, that's a school nurse, and just for parents. But rules, you have to follow rules. We're going to have continuity and we're going to take control of this thing. We can't be going in different ways and haphazard. We have to follow the protocol. We have to take the advice of the federal government, brings it to the state, brings it down to the local here. So Laura, thank you. Your information is invaluable here, and you're certainly welcome back anytime.
You all as well. Thank you.
Laura, I had one comment to make. I don't know if you've read the American Journal of Medicine magazine. There was a great article, Doc. I don't know if you read it. It was compiled by about 50 doctors, and they have a really great, it's kind of almost like a treatment algorithm, but one of the research they've shown throughout the world is, and I found this very interesting, is that if you are positive for COVID, they are, I don't know what the state, what the county has said about this, but I've heard they really don't, it's not a great idea when you're in your home quarantining, make sure you're not wearing a mask. Did you ever have you heard anything about that? Like saying
That's
get fresh
interesting.
air?
I didn't see that.
Yeah, it was about, it says, it was, I can send it out to Cindy, and she can forward it out to everyone. It's a really great article about fresh air and reduced reinoculation. And, when you're in your home quarantine, of course, if you go out in public, you shouldn't be wearing a mask. But if you're in your home and you're with your family, but you're quarantining in your room, you shouldn't be wearing a mask. You should, try to get as much fresh air as possible and not wear a mask where you're re-inoculating yourself. It's a very interesting article, and it'll be a great read. I'll send it over.
I would love that. Thank you so much.
You're welcome.
As Laura said, it changes every day. It really does. What we're talking about today is totally different. We talked about a year ago. And so,
completely different.
Yeah, you think you have it, you think you got it down pat, and you really understand it, and then all of a sudden they throw you a curveball. Okay. Anybody have any questions on any of the statistics, the food handling, any of that stuff like that there? Any questions on any of those things? Okay. The Well Baby Clinic, Cindy, there's not much really going on with that, correct?
That's correct. There has
Okay.
been no report for this month, for January.
And you just want to mention about the stigma free is going on to Zoom meetings.
Yeah, I don't have the information about the date, but I would assume it's a Zoom meeting. I don't know if anybody's available to do that. I can bring up the email.
Okay. We could send it out again. You don't have to do it at this exact moment.
So they're having a meeting on February 23rd at 3 p.m.
Okay. Thank you. Okay.
I might be available to attend that, Steve.
Okay, that'd be awesome. Just to give us some feedback, what's going on with that.
Sure, yep.
Our last meeting was on January 14th, and a few days later, we had the rabies clinic, and the first ever in town, I believe first ever in town, drive-through. And so I'd like, maybe I'll hand it over to Mike. You were there. You want to, and Cindy certainly was there. It was a cold day, but it was dry at least. Mike, you want a little good overview of what it was like, our first drive-through?
Yeah, it was a very unique experiment for me. There was myself, Steve, Linda, my daughter Macy, who's a nursing student. She was there helping to fill the insulin syringes, the syringes, and she was the official cat handler, where she quickly ran away and gave the box to Linda. See Linda reacting. But you know what? To be honest with you, if it wasn't for the occasional person wanting to get out of the car to try to help us, I think it's a much more efficient process than it has been in the past. And I'd be strongly advocating that as we move forward, it's something that we might want to consider. I don't know what else to add, Steve. I think it was a great success. And like I said, I really think we should consider, going to this route moving forward.
Yeah, we had a very good turnout. It was almost as if you were going through a car wash where you come in one end of the building and then you go through and then come out the other end. And the ladies from town hall were awesome doing the paperwork. And basically they were doing just the licensing paperwork kind of thing. And just everything went really quite smooth. They came through and we had the vet there and, boom, people pulling their dogs out. We're stopping them, boom, in the back of the seat sometimes, which actually made it easier when the dog was on the back seat. They gave the shot and they moved on down the path.
I can give you the numbers if you'd like.
Yeah.
We vaccinated 183 dogs and 21 cats.
Yeah.
And how does that compare to other years?
It's pretty close to what we did. I think, if we had a little more time available, we might have been able to do a little more.
And that was a shortness of the vet too. He had
Yeah.
had surgery. He didn't realize that when he was asked that it was we had to cut it a half an hour short because he had surgery to do.
Yeah.
Well, it sounds like it really was a great success. And I like Michael was echoing, I guess having them in the cars also probably eliminates anything with like the dogs. If you do have dogs interacting a little bit where they, you have dogs to bark and can get a little, excited. So that's great.
Yeah. And less doggy accidents. We didn't have any dogs peeing on us or anything like that. So it was pretty good. And it's a fun
That's
day.
always nice.
The community really had a positive response. I put some pictures up on Facebook and I sent it to you all, and a really, really positive response. So it's good. It was well done. It was cold. It was cold that day, but some of the police came by and town workers were there. Town workers did a great job setting it up, keeping everything organized, and it, everybody works together. That's the kind of community we have. Everybody really does a great job when they come together and work on things.
Do we send a thank you to the DPW for all that they did? Because they really had a lot of work to do to get that set up like that.
I think that probably comes from the town clerk.
Oh, okay.
That would probably come, that's where it probably trickles down to.
Yeah.
Well, we've talked about COVID-19 and so why don't we move the agenda, keep going. Anything in the news anybody wants to talk about? Anything they're hearing kind of unique? I have a couple things that are kind of interesting coming down the pike with COVID. Anybody have anything? It looks like tomorrow AstraZeneca is going to apply for emergency use. Either tomorrow or Monday, they're going to apply for emergency application of their vaccine. I think there's about 25 or 30 different other companies that are producing vaccines that are coming down the pipeline. So you're seeing more and more coming out there, and that's pretty interesting. Also, did anybody hear anything about rescheduling mammograms? If you get your vaccination, that you should hold off on your mammogram because they're afraid if your lymph nodes swell up or anything like that. But never even thought of something like that, but kind of makes sense. Kind of makes sense. Not that you shouldn't have your mammogram, but maybe you should reschedule it to just a little bit later time. So I thought that was kind of pretty cool. Something I never would have thought about. All right. Any old business? Anybody have any old business out there?
One other
Donna,
thing,
yeah.
one other thing with getting the vaccines, I know a lot of people are anticipating, oh, am I going to feel sick? Am I going to have a fever? Am I going to do this or that? The research does say, not to take like Tylenol or Advil just because, so just, it's a word to heed, read before, ask your doctor. Don't just take Tylenol or Advil before you get your vaccine just because you think you may have a reaction. You can take anything after for a symptom if you feel that you need it. So I thought that was pretty interesting too for people.
Yeah, that's actually recommended, especially for ibuprofen or that class for NSAIDs, not to do that. But many parents do that for their kids. They give it initially or ahead of the time or half a dose. It actually affects the system, the immune system, inflammatory system. So it's pretty much not recommended for any vaccines. But I mean, I keep hearing from parents that, oh, I just give a dose before I take them for the shots. But I know I have told many people not to, but I'm pretty sure it's just such a common thing to do. And so definitely for any vaccine, that's pretty applicable.
Will interfere with the immune system response?
I have an article that a doctor sent me. I'll send it to Cindy and forward it.
Thank you. So I've searched it times and I really couldn't find anything beyond.
I haven't seen an article, but
Okay, Lynn, go ahead. Sure.
Yeah, I have seen that, like especially during my immunology. Can you guys hear me? Oh, okay. Yeah, right before the immunization testing, like for that at that time, but it was like 10 years ago. I don't think I have the documents with me anymore, but I clearly remember and always recommended. And I was pretty shocked seeing that too, because before becoming an immunizer, obviously I became a pharmacist first, and I never heard that before. And I've always heard the parents talking about giving a little dose of ibuprofen before or ahead of time. So, and that was an eye-opening experience. But like I said, I have recommended to many, but I don't think anyone follows that, which should be followed.
Okay, Lynn, you had a comment? Okay. No, you're still on mute, Lynn. Okay.
yeah, it's giving me. I heard it was counting that
Yeah, Lynn, you're breaking up.
they don't recommend Tylenol or NSAIDs.
Breaking up.
Yeah,
That's better.
you can elaborate on that, Steve.
Yeah. So I think what most people generally are hearing is the first vaccination, really no problems, but maybe a little bit of a sore arm. Second vaccination, you're getting anything. Some people are getting body aches, some fever. Mike, you've had a fun couple weeks, right? After your second vaccination?
Both me and Macy, almost to the minute, 12 hours after that second vaccine, we were both down and out. I was out for 36 hours. She was pretty close to 36 hours. I've seen a lot of people who had a significant reaction to the second vaccine, and once again, mostly 12 hours after, which is good, right? Because that's what you want. You want your body to react to it. But when you're sitting in bed shaking like a leaf at night, it isn't all that much fun, to be honest with you.
Did you both have the same vaccine?
Yep, same vaccine, Moderna. and we had it within, hers was a 3 o'clock appointment, mine was 3:15.
So I'm up March 4th.
Well, you know what? I know people too that had a mild body ache, a headache as their second vaccine, and nothing. And then you have people like me. So it's all over the place.
You're right, Mike. It's all over the place. It's the whole gamut. Some people.
I
nothing.
think it certainly has varied, Steve, and
Yeah.
seeing and hearing a lot, feedback from patients, feedback from nursing friends, was so individualized.
I agree. I agree. Okay. Any old business and new business before we conclude the meeting? All right. Very good. Laura, again, you are welcome anytime. You are a wealth of knowledge today. It was really great to have you. So please come back, please, please, please. And
Thank
I
you
think,
so much. I'd be happy to.
yeah, I think you covered a lot of information that we appreciate, and I know the public would appreciate when they watch this video or listening in. So I'll entertain a motion to adjourn the meeting.
So
First by Sarazik, second by Brock. All in favor, say aye.
Aye.
Everybody, thank you very much, and we'll talk to you soon.
I just,
Good night,
Steve,
everybody. Thank you.
Yes,
Steve, we are meeting next month,
yes,
second Thursday of the month on
Great.
Zoom again.
great. And that'll
Thank
be on
you.
the
Good night,
town,
all.
that'll be on the town's website as well. Thank you, everybody.
Thank you.
Cindy, Cindy, maybe we'll
Yes.
chat why I'm not getting that email. I'm not sure why.
Why don't you do that privately? Yeah.
Yeah, okay,
Yeah,
thanks.
and yeah, we'll talk about that.
Okay, thank
Good
you.
night.